Hello class, my name is Haluya Hadak and I'm here today to discuss the career of nurse anesthetist. There are approximately 44,000 nurse anesthetists in the United States today, including CRNAs and nurse anesthetist students, and this is according to the American Association of Nurse Anesthetists. As a prospective nursing student myself, along with an interview that I have done with a nurse anesthetist at Brenner's Hospital and extensive research, I feel that I can provide you with current and accurate information on the subject. The subject to me is something that's very fascinating, and I hope it is to you as well, but it's also something that's very relatable. Whether we like to or not, we end up in the hospital one way or another when we get sick. Maybe you've gone through a surgery before, maybe you will in the future, or maybe you know someone that has. So therefore, I think it's important to learn a little bit more about the behind the scenes of what happens during a surgery, the medical professionals involved, and what exactly goes on, because they're the ones caring for you when you're vulnerable at this time. You're not feeling well and you just want to feel better. So hopefully with this speech, I can give you a little bit more insight about that. So in order for me to do so, I would first like to explain exactly what a nurse anesthetist is, what they do, how they become inspired to do their job, and why their job is so important in the first place. So to begin, I would like to explain a few of the tasks of a nurse anesthetist. So according to Shira, what she does is she does a lot of preoperative assessments, intraoperative care, and she transfers patients to recovery rooms after the surgery is over. So in preoperative assessments, what you're doing is you're learning more about the patient, their history, their age, their weight, anything that might affect their dosage before they get the anesthesia. And what the anesthesia does is it numbs them so they do not feel any pain during the surgery and they're asleep and unable to move or speak. Therefore, another critical aspect of this job is to monitor their vital signs. You want to make sure that their heart rate isn't increasing or even dropping below the normal rate so that we know that everything's running smoothly. After the surgery is over, Shira will then transfer them to the recovery unit so that they can begin the recovery process. So how do you go about becoming a nurse anesthetist in the first place? It's a very difficult journey and it can often be a long one. So according to Shira, when she was going through her journey, she said it was very difficult. There was often nights where she stayed up studying or doing work, and she also had a lot of clinical rotations that were even sometimes 16 hours. So there's a lot to it. Actually, what you have to do to become a nurse anesthetist is you must first get a nursing degree. You must then have at least 2 years of nursing experience in a critical care department or emergency department. You must then go back to school and go to an accredited nurse anesthesia program and then pass a national certification exam. So obviously there's a lot to it. Next, I would like to explain what has inspired Shira to do her job and the thousands of nurse anesthetists around the world today. Well, according to Shira, she says what inspires her most are her patients. She's always wanted to help people and care for them, and therefore she became a nurse about 10 years ago. After about 8 years, she finally decided that she wanted something a little bit more challenging and more of an increase to her salary. So that's when she stumbled upon the idea of nurse anesthesia. So she's been doing it for a little bit of time now. She has a son herself, which inspires her every day. It allows her to be able to connect with her patients, knowing that she has a son herself and that she knows what it's like for him to be sick. Oftentimes, she says she sings songs to him, sing songs to her patients that she would sing to him, but she can also connect to the families and the parents and comfort them through such a tough time. So that's really what inspires her. Now I would like to move on to why this field is so important. So according to Shira, it's something that's always going to be changing. The industry is growing, there's going to be new medical innovations, and therefore it's important to have medical professionals that know what they're doing and can keep up. There's actually a scarcity of nurse anesthetists, yet there's a demand for them. So therefore, Shira finds that it's important to fill in this gap. She says that there is less of a need for physicians and there's more of a need for advanced nurses. And according to one website, it's expected the nurse anesthetist program or nurse anesthetist field is actually expected to grow 19.3% in the next 10 years. Therefore, it's definitely significant. So overall, I hope you've learned a little bit more information about what they do and why they're so important, what inspires them, and why this job is so important overall. I think it's something that we can all take comfort in knowing, to have medical professionals that love what they do and that really care about their patients. Shira even says that many of these medical professionals go in for the patients rather than the money. So I think it's important to familiarize ourselves with what they do and make this information more public and share with others what exactly a nurse anesthetist do in this field. So I hope you've learned something today. Thank you.